Good evening, beautiful people. Thank you so much for joining us this evening. Hope you're having a fantastic day and week. Welcome to our live weekly YouTube readings of the final report of the California Reparations Task Force right here on the CJEC YouTube channel. This is the only live reading of the California Reparations Task Force final report on YouTube. This final report is of the first in the nation California Reparations Task Force is one of, if not the most important government report about the Black American community since the 1960s. Equally important, it is also the foundation for current and future reparations legislation in California. The report is nearly 1,100 pages long, and we're bringing you every page of it, chapter by chapter, every week on Thursdays at 7 p.m. Pacific Standard Time, so that you are properly educated in your advocacy for reparations in California. Today's reading of the final report is presented to you as a community service with support from the Reparations Organization and Mobilization Team at the Coalition for Just and Equitable California, CJAC. CJAC is California's leading grassroots organization born for reparations and reparative justice for Black American freedmen living in California. For more info on CJAC and our work helping to enact the law that create the California Reparation Task Force, California law requiring state agencies to collect data on descendants of U.S. slavery, the Act to End Current Slavery in California state prisons, the California Freedmen's Affair Bill, and more, visit www.cjec-official.org. Before we go any further right now, I need you to do 3 things. Like this video, hit the bell for reminders, and subscribe to our YouTube channel.
After we're done reading tonight, I need you to do 3 more things. Get connected. Follow CJAC on all social media, Instagram, TikTok, Facebook, and Twitter at CJAC Official. Get informed. Visit www.cjec-official.org and sign up for current and accurate California reparations news and info on our Get Involved page. Get involved. Support our work by volunteering and or donating. To donate, just click the Donate tab on the home page of our website. Special thanks to our amazing fiscal sponsor, the California Black Women's Health Project. By way of introduction, my name is Sharmaine. I live in the Inland Empire. I'm from California Black Lineage Society, BNC, and I'm a volunteer reparations advocate with CJAC's Reparations Organizing and Mobilizing Team. I'd like to dedicate this reading to my ancestors and my 2 children.
By way of introduction, my name is Dr. Tish Crawford. I live in the Inland Empire in Los Angeles County. I am from the California Black Lineage Society, BNC, and I am a volunteer reparations advocate with CJAC's Reparation Organization and Mobilization Team. I like to dedicate this reading to the Crawford family, the Harris family, and the Harmer family. Donald and Ethel Lee Crawford, Ethel Mae Williams, and all of those ancestors that I know I have built my legacy on into.
By way of introduction, my name is Sarah. I live in the Inland Empire. I'm from CBLS, California Black Lineage Society, BNC. I am a volunteer reparations advocate with CJAC's Reparations Organization and Mobilization Team. I would like to dedicate to my children, Cameron Ord and Caleb Ord.
The agenda for today, Chapter 25 of the final report of the California Reparations Task Force. The title of the chapter we're reading tonight, Policies Addressing Pathologizing the African American Family, Chapter 25. You can follow along in the reading. Download tonight's chapter or the full final report yourself by going to our website, www.cjac-official.org/reports. Okay, we are about to get ready to start our reading, but before we do, I have some special thanks and announcements to make. First, as always, I'd like to thank our good friends at ETM Media Group on YouTube for their live readings of the first California Reparations Report. You can watch their readings of the first report on their channel at ETM Media Group on YouTube and on our website at www.cjac-official.org/videos. Today's reading is sponsored by the Civil Rights Institute in Inland Valley, Southern California. Executive Director Sabrina Gonzalez. California Black Lineage Society wants to thank you for allowing us the opportunity to utilize this historical space.
Second, for those of you who don't know, historic reparations legislation in California is here and more is coming. SB 490 is California's first lineage-based reparations-related legislation to establish the California American Freedmen Affairs Agency. The bill was introduced by State Senator Stephen Bradford and will move forward in 2024. To read the bill, visit www.cjac-official.org/advocacy. Third, as mentioned, more historic reparation bills are coming. Over the next several months, more reparation bills will be written. During the 2024 legislative session, we'll see those bills introduced and start moving toward passage by majorities of both the California State Assembly and Senate. To pass reparations bill in 24, we need 41 Assembly members and 21 senators to say yes. When those bills are passed, we need our governor to sign the bills. So make reparations a reality in California. The math is 41 plus 21 plus 1. That's 41 Assembly members, 21 senators, and 1 governor. 41 plus 21 plus 1 equals reparations in California. Lastly, but not least, special thanks to CJAC's Reparations Organization and Mobilizing Team, specifically our volunteer final report readers. And without further ado, Chapter 25 of the California Reparations Task Force Final Report.
Chapter 25, Policies Addressing Pathologizing the African American Family. 1. Policy Recommendations. This chapter details proposals to address harms set forth in Chapter 8, Pathologizing the African American Family. Reduce and seek to eliminate racial disparities in the removal of African American children from their homes and families. Reduce the placement of African American children in foster care and increase kinship placement for African American children. Establish and fund intervention programs that address intimate partner violence, IPV, within the African American community. Eliminate interest on past due child support and eliminate back child support. Eliminate or reduce charges for phone calls from detention facilities located within the state of California. Address disproportionate homelessness among African American Californians. Address disparities and discrimination associated with substance use recovery services. End the underprotection of African American women and girls. Reduce and seek to eliminate racial disparities in the removal of African American children from their homes and families. The rate of removal of African American children from their homes is staggering. In 2021, African American children were 18% of the children in foster care in California, the largest percentage by race, despite constituting only 5% of the overall population of children in California. One report indicates that in 2021, Child Protective Services in California investigated 1/2 of all Black children. In 2022, California Legislative Analyst Office issued a report indicating that the portion of Black youth in foster care is 4 times larger than the portion of Black youth in California overall. Given the disparities, it is likely that racial bias impacts African American families at all stages of the process, including during the reporting of abuse or neglect, the investigation of the allegation, the substantiated of the allegation, and the decision to the removal of the child from the home, and ultimately where the child is placed once the child is removed from the home. As detailed in Chapter 8, Pathologizing African American Families, one 1996 study indicated that the disproportionality of Black children being taken from their parents and placed in foster care does not derive from inherent differences in the rate at which they are abused or neglected, but rather reflects the differential attention received by Black children along the child welfare service pathway. Vague or nebulous definitions of mistreatment or abuse, which is inherently subjective, may allow racial bias to intrude into a lone social worker's decision-making process about whether to initiate an investigation or remove a child. Research has shown that with respect to drug-positive newborns, African American mothers were more likely to have their infant removed than white mothers, even though the overall characteristics or conditions of the infant were similar.
The following recommendations provide a multi-pronged approach to eliminate racial disparities for African American families by implementing procedures in the child welfare system to eliminate the influence racial bias may have on decision-making at every stage. The task force recommends that the legislature require blind removal meetings where a committee of social workers who are unaware of the race of the child and their family make the decision regarding whether a claim of child abuse is substantiated and whether the initial detention of a child from their home is warranted. This recommendation does not include predictive risk modeling tools some agencies have used to augment their decision-making process around initial detentions and removals. Many stakeholders have expressed concerns that predictive risk modeling tools may infringe on civil rights and civil liberties and exuberate racial disproportionality and disparities in child welfare. The task force also recommends that the legislature enact legislation to prohibit child welfare agencies from detaining a child on the basis of a nebulous claim of neglect, where the investigation was initiated based on a report that is rooted in a parent's poverty or lack of resources. This recommended legislation would establish that before a child welfare agency can detain a child based on general neglect, the agency must demonstrate that it has engaged in active efforts. Active efforts mean the agency has taken proactive steps, which may include financial assistance and support services to help parents ameliorate or eliminate the conditions that cause the agency to investigate the family. To address concerns that incongruent cultural standards are often applied to justify the removal of African American children from their families, the task force recommends that the legislature require the testimony of an independent qualified expert on the prevailing cultural practices and standards of the African American community, including child rearing practices, before a child can be removed from their home. A child could be removed only where the qualified expert testifies that continued custody in the home is likely to result in serious emotional or physical damage to the child. Substance abuse or addiction issues are often a driver for the removal of children from their parents. Existing legislation does not disqualify a non-custodial parent from being considered for placement where the parent is in a substance abuse treatment facility, so long as that facility allows minor children to remain with their parent during treatment. Because existing law acknowledges that substance abuse issues without more do not require separating a child from their parent, the task force recommends that the legislature mandate that in cases where the sole issue is a parent substance abuse, child welfare agencies place the family on family maintenance services and use active efforts to place the custodial parent and child in a residential treatment program that allows minors to remain with their parents during treatment before the agency can file a petition to detain that child. Where outpatient treatment has a likelihood of success, the task force recommends legislation requiring agencies to provide family maintenance services along with outpatient treatment before filing a petition to detain a child. The task force further recommends that the legislature enact legislation requiring child welfare agencies to place a child with the non-custodial parent in cases where removal from the custodial parent was necessary, even if the non-custodial parent is in an inpatient substance abuse treatment facility. If the facility allows dependent children to stay with their parents, and placing the child with the non-custodial parent would not be detrimental to the child.
Reduce the placement of African American children in foster care and increase kinship placements for African American children. As detailed in Chapter 8, Pathologizing African American Families, beginning with slavery and continuing through today, extended kinship networks have been necessary for survival for African American mothers and families. Kinship placements also play a key role in the child welfare system for African American children removed from their parents. When a child has been removed from both parents, existing law allows the court to place a child in a variety of placements, including a kinship placement, which refers to the approval home of a relative or non-relative extended family member. Under existing law, placement with a relative is the preferred placement. For the vast majority of children, kinship placements are less traumatic, lead to better outcomes, play a pivotal role in ensuring children's safety, increase placement stability, better assure success in school, and maintain family and community connections. Despite research showing that children placed with relatives have better outcomes, and the statutory preference to place children with relatives, a disproportionate number of African American children continue to be placed in foster care with strangers or in congregate care settings instead. Being Black is a predictive factor of a child's placement in a congregate care setting. The legislature passed Continuum of Child Care Reform legislation in 2015. A collection of reforms aimed to ensure the children removed from the parents are placed in home-based family placements with committed and nurturing caregivers. Under Continuum of Care Reform, congregate settings will be used only to short-term residential therapeutic settings. Even after the passage of the Continuum of Care Reform legislation, disparities in foster care placement for African American children persist. One explanation for this disproportionate placement of African American children in foster care or congregative settings is racial bias. Existing law allows a social worker to consider a relative's good moral character when assessing a relative for placement. But whether a relative has good moral character is a subjective consideration that could be impacted by racial bias. Even when a child is placed in kinship care, however, disparities in resource persist. Children in kinships and their caregivers are among the most underserved in the welfare system. If a child does not qualify for aid to families with dependent children, AFDC, benefits under the Title IV-E of the Social Security Act at the time of removal under the California regulations, a child placed with a relative will receive less cash assistance than if it were the same child that was placed with a non-relative foster care family. 39% of kinship households live below federal poverty line, while only 13% of non-relative foster children care households do. This financial hardship relatives face can influence whether a relative with modest economic means decide to consider for placement. Further, a relative's lack of resources can also factor into a social worker's decision to exclude that relative from consideration for placement. The Department of Social Services to provide the same level of foster care cash assistance benefits to children placed in kinship placement that it provides for children placed in foster home placements. Equalizing foster care cash assistance benefits based on the child instead of the child's placement makes it financially feasible for minors to be placed with relatives who otherwise lack the financial measures and means to take a child in. And placing a child with relatives provides benefits of familial connection and continuity of community without additional cost to the country or to the state, as there is one less child placed in a foster home. In the alternative, the task force recommends that the legislature enacts legislation eliminating or waiving the consideration of a child's eligibility for federal AFDC aid under Title IV-E from its determination of the amount of foster care cash assistance a child placed with relatives will receive, and instead require the Department of Social Services to pay the same level of cash assistance to a child placed in kinship placement as the child would have received if placed in non-relative foster family. The task force also recommends that the legislature amends Welfare and Institutions Code Section 309, subsection D, to authorize financial payments to relatives to purchase whatever is required to provide a home and the necessities of life for the child for as long as the child remains with the relative. Beyond Section 309, existing social welfare programs such as CalWorks and CalFresh or a special fund established by the legislature can be used to provide additional support. The task force further recommends that the legislature include requirement that the agency actively assist relatives in applying for and obtaining benefits under existing social welfare programs. To address potential racial bias in the assessment of relatives for placement, the task force recommends that the legislature amend Welfare and Institutions Code 361.3 to eliminate good moral character from the list of criteria a social worker may consider in deciding whether to place a child with a relative. Another barrier to a relative placement is a criminal background check, which is required for anyone being considered for placement. Under existing law, child welfare agencies has discretion to grant an exemption from disqualification to a relative who has a criminal record. The task force recommends that the legislature enact legislation to prohibit an agency from using a relative's prior nonviolent conviction to disqualify a relative from being considered for placement. Prohibiting agencies from disqualifying relatives with convictions for nonviolent offenses from being considered for placement acknowledges that the criminal justice system in California has disproportionately targeted and convicted African Americans, and because most convictions stem from guilty pleas, which may have been accepted solely to avoid trial and a potential higher sentence, a nonviolent conviction should not disqualify a relative for placement. The task force further recommends that the legislature enact legislation permitting a relative with a prior conviction for a violent offense to be considered for kinship placement, where 1, the conviction is not for a reportable offense under the Penal Code Section 290 or similar provisions. 2, the relative has been free from incarceration and supervision for at least 10 years. 3, the prior conviction for the violent offense is more than 10 years old. And 4, the relative has demonstrated that they are not likely to reoffend. The task force also recommends that the legislature enact legislation permitting relatives with a substantial instance or prior child abuse or neglect to be considered for placement if the substantiated instance occurred at least 10 years before the relative's current placement application and the relative has demonstrated that they are not likely to reoffend.
Establish and fund early intervention programs that address intimate partner violence, IPV, within the African American community. African American victims of intimate partner violence, IPV, face unique and historically rooted challenges in seeking and obtaining services related to safety, prevention, and treatment. For example, African American victims of IPV may harbor a justifiable distrust of law enforcement and social service providers, which in turn limits the protection and the support that these victims receive. Many women refrain from seeking assistance out of fear of losing their children to a discriminatory child welfare system. And even when assistance is sought, many of the service providers fail to provide the kind of culturally competent, trauma-informed services that are most effective. Moreover, because African American women face disproportionately higher rates of IPV, these challenges result in the neediest population receiving the least amount of support. The task force recommends that the legislature fund community-based organization, CBLS, and treatment programs that provide IPV services to treat victims, perpetrator, and minor children within the family who may have been exposed to IPV. The legislature would include adequate funding for CBOs and treatment centers to expand services to improve outreach to victims and perpetrators of IPV, provide appropriate services tailored to address the needs of the family on the basis of the severity and the duration of the IPV. CBOs and treatment programs would provide a range of services, including partnering with hospitals, clinics, and mental health centers to provide IPV self-assessment tools and referral information for IPV victims, where providers may encounter victims of IPV, providing direct cash assistance to IPV victims to allow victims to separate from the perpetrator, and assisting victims in applying for benefits and accessing job training. CalWorks can be used to provide temporary direct cash assistance for IPV victims. Because exposure to IPV causes trauma to children, the task force recommends that the legislature require the CBOs and treatment programs to provide services or a referral and payment for appropriate services for minor children who have been exposed to IPV. The legislature would also fund IPV prevention and early intervention treatment programs, including graduated treatment options for victims and IPV perpetrators based on the severity and the duration of IPV. One study indicates that conjoint counseling or conjoint couple treatment was more effective in reducing recidivism over a 6-month period than individual couples treatment. Where the victim is fully supported of conjoint treatment, where the violence has been mild to moderate, and where both parties want to remain together. The victim and the perpetrator can be referred to a multiple couple conjoint treatment program for IPV. Eliminate interest on past due child support and back child support debt. As discussed throughout Chapter 8, Pathologizing African American Families, discriminatory federal laws have torn African American families apart. One effect of these long-standing harms is the disproportionate amount of African Americans who are burdened with child support debt. Although African Americans are less than 7% of California's population, they represent around 18% of the parents who owe child support debt. Under current law, California charges 10% interest on back support, which is more than 3.5 times greater than the national average. The 10% interest rate quickly increases the amount of the child support debt owed. As a result, the debt owed for Black child support and interest, a disproportionate number of African American parents are saddled with a crushing debt that hinders their ability to attend school or job training, maintain housing, and find employment if their professional licenses or driver's license has been suspended because of the failure to pay child support debt. A 2003 study commissioned by the California Department of Child Support Services estimate that 27% of California's child support arrears was unpaid interest. The same study showed that child support debtors had lower incomes than typical California worker. The study indicated that even if the debtor paid 50% of their net income towards their child support debt, back support, and interest, only 25% of the debt owed for child support arrears interest will be collected over the next 10 years. In 2020, Governor Gavin Newsom vetoed AB 1092, which would have prospectively terminated interest on child support arrears owed to the state. The task force recommends that the legislature enact legislation to terminate all interest accrued on child support, requiring only the payment of the principal owed. At a minimum, the proposal recommends that the legislature eliminate the prospective accrual of interest on child support debt for low-income parents. The task force further recommends that the legislature amend Family Code Section 17560, the offers in compromise provision, to allow for offers in compromise and forgiveness of child support debt based solely on parents' financial circumstances and ability to pay. The task force recommends that the legislature amend Section 17560 to eliminate the requirement that the amount of the compromise equal or exceeds the amount the state would be reimbursed under federal programs like temporary assistance to needy families.
Eliminate or reduce charges for phone calls from detention facilities located within the state of California. Under current law, county sheriffs may charge incarcerated persons per-minute fees and associated charges for telephone calls. Although the profits from these fees ostensibly go toward services and resources for those who are detained, the funds are often mismanaged and or misdirected. Moreover, the financial burden falls disproportionately on low-income African-American families during what can be the most challenging and destabilizing time of life when a loved one is incarcerated. Ultimately, the fees force families to choose between not communicating with incarcerated family members or spending scarce resources to do so. Moreover, studies have shown that consistent family contact for incarcerated individuals improves re-entry outcomes and reduces recidivism. In recognition of these dynamics, Senate Bill 1008, 2021 through 2022 Reg Sesh made all calls from state prisoners and juvenile detainees free. And many local governments have made county jail calls free. In furtherance of this movement, the task force recommends that the legislature preclude county jails from profiting from their incarcerated persons by mandating that all calls from incarcerated individuals, state and county, be free. The legislature should similarly limit the price markups of commissary items sold to incarcerated individuals by stores within jails or prisons. Another instance of jails profiting from the most vulnerable Californians. Address disproportionate homelessness among African-American Californians. African-American Californians make up a disproportionate share of the state's unhoused population, while Black individuals make up only 5.3% of the state's population. They comprised 26.6% of unhoused individuals that contacted homeless service providers in the 2021-2022 fiscal year. A recent report on Black homelessness in Los Angeles concluded that the impact of institutional and structural racism in education, criminal justice, housing, employment, health care, and access to opportunities cannot be denied. Homelessness is a byproduct of racism in America. The same study concluded that the interconnectedness of incarceration and homelessness creates a revolving door that only serves to make the fight of homelessness more challenging and complex. To address the complex web of issues associated with disproportionate homelessness among African Americans, the task force makes the following recommendations. Streamline and incentivize development of permanent supportive housing and extremely low income housing. As discussed in Chapter 5, housing segregation, discriminatory state and local urban renewal, highway construction, and gentrification policies have destroyed African American communities and produced, among other effects, disproportionate homelessness among African American Californians. Permanent supportive housing and extremely low income housing are critical components of addressing the homelessness crisis. Permanent supportive housing provides housing to those with substantial physical or behavioral disabilities and provides on-site treatment and services. Extremely low income households are those whose income are at or below the poverty guideline, or 30% of the area median income. Unfortunately, the costs and delays associated with permanent supportive housing developments have severely impacted their feasibility in many communities. The task force accordingly recommends that the legislature provide subsidies to developers and property managers of permanent supportive housing and extremely low income housing. Establish state-funded and state-operated permanent supportive housing and or extremely low income housing, akin to those proposed in Assembly Bill 2053, 2021 through 2022 Reg Sesh, and create exemptions for extremely low income and permanent supportive housing developments from applicable zoning and permitting regulations. Mandate anti-bias and other trainings for staff of homeless service providers. A recent report by the California Policy Lab found that implicit anti-Black bias and prejudice exist among the case managers, property managers, and landlords that ostensibly should be supporting unhoused individuals. The task force thus recommends the legislature mandate implicit bias training for designated homeless service providers and or fund statewide studies of racism within homeless service systems. Other training topics should include cultural competency, trauma-informed care, institutional racism, and the needs of diverse unhoused populations, particularly descendant and African American individuals. Fund permanent supporting housing diversion programs for individuals incarcerated in county jails. Permanent supportive housing reduces homelessness amongst those with substantial physical disabilities or mental health issues. A pilot program in Los Angeles County Just in Reach, Pay for Success, created a diversion program for county jail inmates with histories of homelessness and physical or behavioral disabilities. The program placed qualified individuals into permanent supportive housing units and provided wraparound services. A study of the program found that its cost was fully offset by decreased use of shelters, inpatient hospitalization, and incarceration. In light of the program's success and cost effectiveness, the task force recommends that the legislature allocate funding for similar programs throughout the state.
Fund a study and analysis of county jail efforts to secure housing for incarcerated individuals upon release. Studies have shown that formerly incarcerated individuals are almost 10 times more likely to be homeless than the general public, and that formerly incarcerated Black men have much higher rates of unsheltered homelessness than white or Hispanic men. Senate Bill 903 2021-2022 Reg Specs requires a rigorous study and analysis of the Department of Corrections and Rehabilitation's efforts to assist those individuals recently released from incarceration with any housing needs. The task force recommends that the legislature mandate a similar study with respect to individuals recently released from the county jails. Develop and launch racial equity initiative and targeted funding measures. In light of the disproportionate numbers of African American unhoused individuals, the task force recommends that the legislature mandate a racial equity analysis of California's housing and homelessness program. The analysis would be geared towards ensuring equitable contracting, increasing African American participation and employment in such programs with special consideration for descendants, promoting racial diversity to all relevant agencies and offices, ensuring that the management is appropriately trained in cultural competency, and creating opportunities for people with lived experiences with homelessness to participate in reform efforts. Relatedly, the task force recommends that the legislature allocate sufficient funding to address the root causes of African American Californians experiencing homelessness, and through grants to qualified culturally congruent services providers, particularly African American funded organizations that serve African American communities with special consideration for descendants, support the delivery and comprehensive services needed to reduce and eliminate disparities and more generally improve access to affordable housing, employment, mental health and physical health services, youth development, public benefits, education, and civic engagement. Funding priorities should include, but not be limited to, emergency rental assistance, eviction counseling, and rapid rehousing plans. Funding and training should be also provided to faith institutions and non-traditional sites, i.e. beauty, barbershop, community colleges, neighborhood markets that interact with unhoused populations to enable these entities to provide services and or resources. The funding would be prioritized for organizations that use a community-based participatory approach to services that rely on employing individuals with lived experiences with homelessness. Finally, funding should also be prioritized for efforts to prevent loss of home ownership, particularly among African American seniors, including education around financial literacy and investment education to protect against scams and access to resources to prevent foreclosure. Increase compensation for homelessness services providers. Frontline workers and staff the MIRA programs and services that support the unhoused community. Unfortunately, wages for these workers are frequently extremely low. Unsurprisingly, low wages relative to the cost of housing have contributed to the chronic understaffing and extremely high turnover among homeless service providers in California. The end result is a substantial negative impact on the quality of homeless services. Accordingly, the task force recommends that the legislature include compensation requirements or wage floors baselines in its grants to service providers. The funding or statutory schemes should include resources and requirements for 24-hour skilled staffing at shelters and permanent supported housing, ongoing training for case managers on trauma-informed practices, and peer advocate programs that pair residents with individuals with lived experience being housed.
Strengthen housing eligibility and tenant protections. To address the housing crisis in the African American community, the task force recommends that the legislature pass legislation as needed and call for federal action as appropriate to ensure more robust protections within the private market as well as within public housing and voucher programs. These protections should advance a number of reforms, including 1, a fully funded framework for investigation of enforcement against discriminatory practices in housing and employment. 2, removing barriers to eligibility and expanding access to public housing. 3, protections to preserve and enhance the rights of tenants living in public housing. 4, protections against Section 8 and other housing subsidies discrimination. 5, expansion of source of income discrimination protections. 6, expansion of just cause eviction requirements to all residential rental housing. 7, prohibition of criminal background checks and tenant screening. 8, broader rent control measures. 9, right to counsel and financial assistance for eviction proceedings. 10, stronger protections against landlord retaliation. Enact protections to ensure care courts do not disproportionately impact descendants African American community. Care courts were established through the recently passed Senate Bill 1338, 2021-2022 reg session. The legislation authorizes a new civil court proceeding, encouraged and ultimately compelled those suffering from severe mental illness to engage in a treatment and housing program. Proceedings may be initiated by family, behavioral health professionals, Medi-Cal providers, and various designees of community health organizations or first responders, including firefighters and police officers. If the court determines that the individual meets the care criteria but refuses to engage voluntarily in services, the court orders the development of a care plan. If the individual does not abide by the care plan, the court can initiate conservatorship proceedings. Although the legislature was nearly unanimous in passing the CARE Act, advocates and analysts have raised a host of concerns. For example, many have urged that there are insufficient resources such as housing, mental health workers, and treatment programs to implement to the legislation. A particular concern to the task force is the likelihood that the care courts will disproportionately impact the African American community. Indeed, as discussed in Chapter 12, Mental and Physical Harms and Neglect, in Chapter 11, An Unjust Legal System, this community is consistently over-policed, misdiagnosed, and subjected to higher rates of homelessness. Care courts will therefore disproportionately enmesh African Americans in a new web of compelled court proceedings. For these and other reasons, organizations such as the ACLU, Human Rights Watch, and disability rights advocates oppose the legislation. The CARE Act includes various data collections and reporting requirements, including demographic and health equity data, as well as training mandates, including training for key participants in elimination of bias. However, to fully guard against potential harmful impact of care courts on the African American and descendant communities, the task force recommends that the legislature require relevant agencies to collect and report data on the source of the referral to ensure, for example, that over-policing is not contributing to over-representation of African Americans. Moreover, all existing data collection and reporting requirements should be expanded to include descendant status. To address the documented persistence of misdiagnosis of African Americans, the task force recommends that the legislature require training and technical assistance for relevant behavioral health agencies in the misdiagnosis of African American individuals for psychotic and other mental disorders. Finally, the CARE Act currently requires petitioners to show that compelled treatment would be the least restrictive alternative necessary to ensure the person's recovery and stability. But this requirement is likely insufficient to ensure that the unhoused individuals are not automatically shunted into care courts. According to the task force, recommends that the legislature require that any referral to a care court specifies all prior voluntary efforts to secure housing and the treatment for the referred individual, and that efforts be prerequisites to care court's acceptance. The final recommendation would ensure that the unhoused and mentally ill individuals are afforded comprehensive community support prior to being compelled to participate in care process.
Address disparities and discriminations associated with substance abuse recovery services. Substance use disorder and addiction are prevalent across all ethnicities, but certain substance issues, such as with opioids and amphetamines, are most common among the African American population. Inequities also exist in the treatment and recovery fields. For example, death rates from synthetic opioid use increased nationwide by 818% between 2014 and 2017 among African Americans, more than for any other racial group during the same period. Moreover, significant gaps exist within the provision of equitable services and treatment outcomes for those in the Black community. These gaps include a disproportionately small number of Black professionals in the addiction treatment workforce, as well as disparate treatment outcomes for Black clients. Finally, economic barriers lead Black clients to use treatment services less than white clients. And they also have lower treatment retention rates compared to white clients. The disparities also exist at the level of prescription medication used to treat addiction. African American patients are 77% less likely to be prescribed buprenorphine and are more likely to receive methadone as an alternative treatment for opioid addiction. While both drugs are effective, buprenorphine treatment is much easier to maintain. Methadone is more highly regulated, and patients receiving methadone, unlike those receiving buprenorphine, must travel to a clinic each day to receive treatment, causing significant additional recovery burdens. Methadone treatment is also generally more stigmatized than buprenorphine, and methadone programs require random drug testing and counseling that are not similarly mandated for buprenorphine. Finally, addiction and treatment disparities must be understood within the broader context of urban planning, land use, and zoning. Indeed, nuisance properties, including alcohol, tobacco, and marijuana shops, are disproportionately located in low-income communities of color, which in turn can lead to higher rates of substance use and abuse. In light of these systemic issues, the task force recommends a number of measures to reduce disparities in treatment and recovery. Increased funding streams to community-based treatment and prevention organizations, including those linked to the criminal justice system. Community-based organizations play a central role in both preventing and treating substance use disorders. The task force thus recommends increased funding for community-based organizations that provide substance use treatment and related services, with particular focus on organizations run and staffed by African American professionals and that serve the African American community, with special consideration for descendants. A primary funding source could be the Health Equity and Racial Justice Fund within the California Department of Public Health's Office of Health Equity. A separate proposal in Chapter 29, Policies Addressing Mental and Physical Harm and Neglect, recommends funding the Health Equity and Racial Justice Fund. Funding would be prioritized for organizations taking a holistic approach to recovery that addresses root causes of substance use, such as housing instability, unemployment, and criminal justice involvement. Funding should also be prioritized for community-based organizations that address community-wide issues related to addiction, such as land use and zoning factors. Example, density of liquor stores, cannabis dispensaries, and smoke shops. Finally, since substance use is frequently associated with recent incarceration, funding should be allocated for service providers stationed near county jails and state prisons that can provide treatment assistance immediately upon release. The use of evidence-based practices would not be a bar to funding, nor would it be prioritized. In addition, jails and prisons should increase community-based organizations' access to incarcerated individuals so they can provide treatment to those in custody. This access may be more limited in the county jails and therefore require greater attention by the legislature and state entities enforcing legislation that permits community-based organizations to have such access.
Promote educational and employment opportunities in substance use treatment fields. The lack of cultural competency or cultural humility in healthcare and substance use treatment likely contributes to racial disparities in treatment outcomes. Thus, as urged by the National Association for Addiction Professionals, it is imperative that we recommit our efforts to the recruitment and training of Black individuals to build a powerfully diverse substance use and mental health care workforce. A separate set of proposals set forth in Chapter 29, Policies Addressing Mental and Physical Harm and Neglect, calls for expansion of the UC Prime-led ABC program and the funding of equivalents for other fields to increase the number of African American physicians, psychologists, and counselors. To the extent not already covered by those proposals, the task force also recommends similar funding and program expansion for substance use treatment professionals. Mandate statewide data collection and analysis of California drug courts. Drug courts in which defendants charged with drug crimes are directed to treatment rather than incarceration or other punishments can be a powerful tool in combating both addiction and recidivism. But participation in California drug courts have plummeted in recent years, potentially due in part to the passage of laws that remove state funding for drug courts, such as Assembly Bill 109. To address this pressure issue, policymakers and stakeholders need comprehensive statewide data, which is currently unavailable. According to the task force, recommends that legislature mandate data collection and publication of key metrics from every drug court and other diversion court throughout the state, including data that would expose disparities, if any, in the offering of diversion, enrollment, and completion. These data would be leveraged to craft policies to improve the reach and efficacy of these programs. Expand access to naloxone, buprenorphine, and other critical substance of use medications and access the scope and genesis of any treatment disparities. Naloxone, commonly known as Narcan, is the only FDA-approved medication to reverse opioid-related overdoses. The United States Surgeon General and the United States Department of Health and Human Services have both encouraged the widespread use and availability of naloxone to prevent overdose deaths. In California, the naloxone distribution project within the Department of Health Care Services distributes free naloxone to qualifying organizations and entities. The task force recommends that the legislature make naloxone more readily available to save lives, particularly because the disproportionate rate of which African Americans in California die from opioid overdose. Under this proposal, funding for the naloxone distribution project would be increased as necessary, and all public schools within California would be required to keep naloxone on school premises. In addition, all jails, prisons, and juvenile facilities should have naloxone readily available on all floors, modules, and segments as occurs in Los Angeles County jails. Additionally, as discussed above, buprenorphine is an effective and convenient treatment for opioid addiction, but it is underprescribed in the African American population. Thus, a two-tier treatment system exists where buprenorphine is accessed by whites, high income, and privately insured, while methadone is accessed by people of color, low income, and publicly insured. According to the task force, recommends that the legislature fund a study of this problem within California, including potential disparities associated with other medications, and to identify potential solutions to remedy African American patients' unequal access to buprenorphine and other addiction treatments. Specific focus should be placed on Medi-Cal reimbursement rates to ensure that they provide sufficient incentive to healthcare providers to remedy unequal access.
In the underprotection of African American women and girls. While suffering the harms of over-policing, African American communities also endure the harm of being underprotected. African American women and girls in particular face heightened risk of harm, and yet crimes against them do not draw the same attention given to crimes against white women. In 2022, for example, 36%, 97,924 of the 271,493 women who were reported missing in the United States were African American, though they were less than 15% of the population. At least 4 African American women per day were murdered in 2020. And African American women comprised 40% of the female homicides in the United States that year. More than 20% of African American women experienced rape in their lifetime, a higher share than women overall, and 45% experienced physical violence, sexual, or stalking from their intimate partner. African American transgender women face an especially heightened risk of violence that has been described as a pandemic within a pandemic. African American women and girls also face an increased risk of being trafficked. 40% of sex trafficking victims in a 2-year study were identified as African American women, and more than half of juvenile prostitution arrests, the arrest of children who have been trafficked, are of African American children. Despite substantial anecdotal evidence of police under-investigating crimes against African American women and girls with the same level of resources dedicated to other victims, little effort has been made to document the racial gap in protection. Pathologizing myths and stereotypes about African American women and girls, coupled with less willingness to believe these women and these girls, may help explain the gap. To generate data on this subject and bring about more equitable levels of protection, the task force recommends that the legislature pass legislation with adequate funding to require law enforcement agencies to document resources devoted to crime investigation, aggravated by race, gender, income, and reported harms, report these data to the Department of Justice, and make the data available to the public. The task force further recommends that the legislature examine means of ensuring more just and equitable treatment of African American crime victims, including women and girls in particular, and to take further steps needed to reduce harms, investigate as needed, and provide appropriate, respectful, comprehensive, culturally congruent services to victims. This study should include the identification and assessment of policies and programs that have been shown to be effective in reducing risk and improving outcomes for African American women and girls.
And that will conclude tonight's reading of Chapter 25 of the California Reparation Task Force Final Report. Before you go, if you haven't done so already, don't forget to like this video, hit the bell for reminders, subscribe to our YouTube channel. When you go, don't forget to get connected, following CJAC on all social media, Instagram, TikTok, Facebook, and Twitter as CJAC Official. Get informed. Visit www.cjac-official.org and sign up for current and accurate California reparation news and info on our Get Involved page. Get involved. Support our work by volunteering and donating. To donate, just click the Donate tab on the home page of our website. Special thanks to our amazing fiscal sponsors, the California Black Women's Health Project. Thank you all so much for your time. We appreciate you all. We are closer to reparations than we ever been in California. Have a great night and stay in the fight.